Welcome back to Open Line. Talking about health care in Tennessee. We have with us Chris Coleman, Tennessee Justice Center staff attorney. The last caller was Ann, and Ann was talking about pre-existing conditions. We kind of addressed that. She also talked about the cost of her medicines, how much they are. It's interesting. She says she's lucky, $600 a month for insurance. She's retired. I guess that's through her retirement. $600 a month. So that's pretty good for her and her husband.
Sure.
But then the medicines, she talked about just the wild cost of just one medicine.
There are a number of reasons why medicines are so expensive in this country, and why people go to Canada to get cheaper meds. One reason, and one of the main reasons, is Medicare is one of the main cost drivers. It's the biggest buyer, and Congress prohibits Medicare from negotiating drug prices. So it's the largest buyer, but in complete violation of any kind of market principles about, well, we're the largest buyer, so maybe you'll give us a discount. Congress has said, no, the federal government can't do that. That's a gift to the pharma industry. Mm-hmm. It just says, we'll pay you whatever you want to charge us. And that ends up being the cost leader for everybody else.
It's the pharma industry that wants that, right? Sure. I mean, they're the ones that are saying, Congress is all about saving money, until the pharma comes along and says, well, don't negotiate down the cost of these medicines.
Right.
And they're like, okay, they give us a lot of money. It frustrates me listening to it just in the small amount of time I listen to it. How frustrated are you by the state of healthcare in our state and our country right now?
I think we have made a lot of strides, and some states have really taken advantage. The Affordable Care Act let's remember, the Affordable Care Act started, the origins of the idea came in a paper in 1989 from the Heritage Foundation, a conservative think tank. And this became the alternative to President Clinton's health plan. It was supported by Newt Gingrich and Orrin Hatch and lots of Republicans, and then it was implemented by Mitt Romney in Massachusetts, and then it was implemented on the national level with the Affordable Care Act. But at that point, conservatives, it was a conservative idea. The entire idea of the Affordable Care Act originated with conservative think tanks by slowly picking at it away. It's death by 1,000 cuts. We've weakened what has been a great step forward. More people are insured today because of the Affordable Care Act. Healthcare everybody complains about rising premiums as if premiums weren't rising before the Affordable Care Act. Yes, premiums have continued to go up. Now people have subsidies to help them afford it if they buy through the healthcare marketplace. So we're definitely better off than we were in 2009 before the ACA was passed. But the fact is, the Supreme Court's decision that allowed states to opt out of Medicaid, the Medicaid expansion, has been devastating especially for southern states like Tennessee. That's where only Arkansas, Louisiana, and Kentucky in the South have expanded Medicaid. And it shows, and their hospitals are doing better. More people are covered. Their mortality rates are lower because they've expanded Medicaid.
Let's go to Swan. Hello, Swan. All right, turn down your TV. Everyone turn down your TV when you go on. But Swan, what's on your mind?
A couple of things. I had signed up for Obamacare back when that was in effect, and I got all kinds of paperwork, sign up through the healthcare marketplace to get that signed up for that. And I thought it was a pretty good deal. They were charging me $40 a month. I thought, okay, I can swing this. And then about, 3 or 4 months into it, I got a message saying that they had realized that I had not paid my taxes. I have since subsequently caught up my taxes, but at the time I was behind. And they said, well, we don't know exactly what your income is, and so because we can't validate that, we're going to go ahead and charge you the full boat. And it went from $40 a month to $600 a month. Are you still there?
Yeah, we're still here. Go ahead.
So my question is that it's such a wonderful deal for me to pay $40 a month under this wonderful plan, but then all of a sudden when they realized I wasn't broke enough to be eligible for that plan, they jumped up from $40 a month to $600 a month. My question is, who was paying the $540 in the meantime? Who was covering that gap? I mean, if that's what that costs. That's my first question. My second question is how come there's no transparency in pricing? I had a medical procedure conducted, and I got a bill from the doctor, I got a bill from the hospital, I got a bill from the anesthesiologist, I got a bill from a lot of different people that were involved in the process. When I go to a restaurant and I order something off the menu, they tell me up front what it costs. Therefore, I can pick, if I don't have a lot of money, I pick the salad and the soup. If I do have money in my pocket, I get the steak and the potato and an hors d'oeuvre or whatever else.
Right.
But with respect to the medical community, there is no upfront pricing. There's no transparency, except for like with respect to maybe like LASIK surgery. And that's why you can go get your done for like $99 per eye. But if you have any other, mystery procedure, they end up saying, well, we sent the doctor. It cost $16,000, and you're only on the hook for $2,000.
Yeah.
But I never get a note from my doctor that says, hey, thanks for paying your health insurance because we just got a check for $16,000. There's no transparency. For all I know, that doctor never got that money.
All right, let's talk about that. Those are two good points. Boy, transparency and pricing. I thought there was a bill that was just passed that requires that.
There have been moves toward more transparency in pricing, but the fact is most pricing is negotiated privately and secretly between hospitals or other medical providers and insurance companies. And the prices that they negotiate are different than the prices if you go in without insurance that you would pay. There's a whole different price list depending on what insurance you have, and there is very little transparency in that. Hospitals.
Why is that okay? Like, I agree with his frustration. Why in the world is that okay?
Well, it's not okay, but that is the world we live in. There needs to be more of it, and the ACA and other acts have pushed for more transparency. We know, for example, Medicare, which is the main, again, the sort of cost leader in everything. It sets the prices for everything else. We know what Medicare pays for things, and that can help gauge what the price range is going to be. But hospitals, especially for people without insurance, can charge exponentially more, and one of the reasons they do that is then when the person can't pay, they can write off. Let's say Medicare, it would be a $50,000 procedure. If you're uninsured, it would cost $100,000. You can't pay $100,000, then they get to say, "Oh, we gave $100,000 in charity care." So that's.
Meanwhile, do they though go after you for the $100,000? Is that person stuck with having to file bankruptcy and that kind of thing based on a $100,000 bill?
Yes. Tennessee is one of the leaders in the nation in medical bankruptcies. It's the number one reason people in America file bankruptcy is because they have medical debt that they can't afford. Often what hospitals and other providers do is just sell this off to collection agencies, and then it goes through the cycle. Many people pay off their debt, but it's already been sold to someone else, so they're still getting hounded by collectors. It's a huge problem, and one that increased transparency in pricing would help. The fact is, though, most people, they're not shopping in the way that you would off a menu, where you just say this. Say, I don't have a choice between a steak and a salad. I have to get, the angioplasty. So whatever it costs. This is the hospital closest to me. This is my doctor, and this is the hospital you use. So you really don't have a choice in where you go. That's why decent insurance is so important. Is because ultimately that is between the insurance company and the provider to negotiate how much it costs. You get it. You get your surgery, and you've paid your premiums. You've paid what it costs for you by paying your insurance company. Whatever your insurance company pays, that's between the provider and the insurance company.
It just seems like that should be something that we could pass, because we can't seem to pass anything. Right. But it seems like we could pass that. Everyone talks about a menu, and we still don't have that. And it seems like we should be able to know what X and X is going to cost. And I think the reason we can't is because powerful groups don't want that stuff out there.
And one of the biggest problems is, let's say you have insurance, you go to a hospital, that hospital is in your insurance network. So that's an in-network provider and it's covered by your insurance. But let's say the anesthesiologist that works in that hospital is not in your network. So you end up stuck with this huge bill that, hey, I thought Vanderbilt was in my plan. Well, it is, but the anesthesiologist is not, and they all bill separately. So there's a huge problem with surprise billing of people who thought they were doing everything right. And so there are movements in Congress now to address that by saying either providers within hospitals have to accept the insurance of that hospital's network or various things like that.
It'll be very nice when Congress passes that, which I'm sure is going to happen anytime. But I mean, you're just so frustrated because they do nothing. All they do is argue, and there seem to be things that are just obvious, and people are suffering, and it's just astounding that more can't be done, to me. But, well, you deal with this every day.
Yeah.
So then his other question, all right, and that's an interesting question. He was paying $40 a month. He signed up under Obamacare. Then there was a problem. He hadn't paid his taxes. It went up to $600 a month. He wondered who was paying the other $560 when he was just paying $40.
Okay. So one of the main subsidy that the Affordable Care Act offers people who are buying private insurance. So you're not eligible for Medicare, you're not eligible for Medicaid, you're just buying a plan. That subsidy is actually a tax credit. And the way that tax credit works is you say, this year I expect to make X amount of money. So based on what you expect to make, they go ahead and say, okay, your tax credit would be this amount. And we will go ahead and give you that tax credit in advance by paying your premiums or some portion of your premium. So if it was $600, that $550 is your tax credit. That's what you're getting back in taxes. If then you don't file taxes at the end of the year, you don't get that tax credit. You have to pay it back. Or if you project your income wrong, there could be, if you made more than you thought that you would, so your tax credit would be slightly less than you thought, you do have to pay that back at the end of the year. And vice versa, if you made less and you didn't get as big a tax credit, you will get that back as a tax refund. But all this is just like a mortgage tax or mortgage tax deduction or a child tax deduction or charity that you give on your taxes. All of this is just a tax credit. Mm-hmm. It just happens to work by being paid to the insurance company rather than direct to the consumer.
All right, we have to take a break. Ray and others, hold on the line. If you want to call in, there's the number 615-737-PLUS, 615-737-7587. I want to hear your thoughts, your situation, your story. We'll take a break. Be back right after this.